Wow, that really makes you stop and think, doesn't it? Fraudulent supplements and vitamins. What's really in some of that stuff? And why do we just buy them off the shops? I can't even talk. It's Monday, guys. And just wondering if they're going to work for us. And what about diet myths? We thought we would ask Dr. James Hardeman. He's joining us this morning. He's written a book titled Appears Younger Than Stated Age, A Doctor's Secret on the Art of Staying Young. Now, you know what, Doctor, nobody wants to get old. But what are some of the secrets of staying young?
Well, the title of my book is actually a term that doctors have been using for generations to describe that occasional patient who looks good for his or her age. And I've noticed in practicing for 30 years or so that these patients seem to have in common that they have a dedication to good health. So my book is not about Botox or cosmetic surgery. It's all about looking younger from the inside out by being healthier.
Okay, so we just saw that video about vitamins and supplements. Do we really need all of those in our daily diet?
One of my chapters is about myths, and one of the myths is take your vitamins every day. And I say that that is sort of a semi-myth because we do need to take vitamins, but not necessarily in tablet form. What we're talking about is dietary supplements, which are substances we ingest that are not food or food additives, and this does not apply to FDA-approved medications, which have to be shown to be safe and effective. The rules that regulate dietary supplements are much more lax. They don't have the burden of proof to demonstrate safety or to back up their health claims. And so they are definitely not in the same category as regular medications. Now, it's convenient to divide them into two groups. One is vitamins and one is the non-vitamin group, which includes botanicals, amino acids, and non-herbal compounds. I'd like to talk about the second group first because they are not necessary for the body, but they are taken for their alleged health benefits. Some of the examples I have here are St. John's wort, echinacea, liver detox, whatever that is. But these compounds have rarely been subjected to randomized controlled trials, and so what we're really talking about is putting largely untested, loosely regulated chemicals into your body that could even interact with medicines that you already take. So my take on it is that the non-vitamin group, it just doesn't make any common sense to take them. I neither take nor recommend them. And in fact, on the bottle, it has a disclaimer. This product is not intended to diagnose, treat, cure, or prevent any disease. So why would you take it?
Why would you take it? When you hear echinacea so often for, what is it, to help the common cold, where wouldn't you want to just up your vitamin C?
I don't think that you should do either.
Really?
Either one of them is going to result in your improving over a week or 10 days, and there's no evidence really to support either one of them. Now, vitamins are a whole different situation because we do need those, but if you eat a normal diet, you usually get enough vitamins, with a few exceptions. I think that most doctors would not disagree with people taking a one-a-day vitamin. In fact, I do that myself. But I think there are several aspects of vitamins that should be discouraged. One is if some is good, more is better, and more could be toxic. And the other issue is that some people who take vitamins feel that that somehow excuses them from eating a healthy diet.
And
really,
not the case.
Healthy eating has been shown to be of more benefit than taking additional vitamins.
When we're looking at certain vitamins, what should we be looking for that stands out, that is more of a better vitamin versus another?
I think the better vitamin is a generic, once-a-day type vitamin that's inexpensive.
Okay. Diet myths. You know, so often we want to pop that pill and lose that 10 pounds, and that's not the case. Quickly, let's talk about number one. You should drink at least 8 glasses of water a day.
Well, some days you might. On a warm summer day, maybe more than that, but the body has a sensitive thirst mechanism in a part of the brain called the hypothalamus, which detects hydration. It tells you when you need to drink. You can drink too much water, so it just makes most sense to me, if your thirst mechanism is not impaired, to allow the body to decide rather than targeting an arbitrary number of glasses of water per day.
Okay, and vitamins, should we take them every day?
I think that the best advice based on scientific evidence is that if you want to take more vitamins, that you should probably ditch the pills and just eat more fruits and vegetables.
Stick with the basics, with the natural stuff, right?
Right.
Oh, thank you so much for joining us this morning. Doctor, where can we find your book?
The usual places, Amazon, Barnes & Noble. It's also an ebook, too.
Perfect. Thank you. We'll be right back after this, everybody.